Hey everyone, welcome to South Georgia Medical Center. This is Erica Bennett and I'm here with President and CEO Ronald Dean, and we just thought it was important to provide you with another update of what is going on here locally with our health system. And specifically, Mr. Dean, we've received a lot of questions lately regarding whether or not our community has seen the peak here locally. What is your feedback on that and how are we checking on that?
You're right, Erica. A lot of people are asking, have we reached our peak? Are we beyond our peak? And I'm not sure I'm the one to answer it, but let me tell you what's going on here, and I'll give you some perspective and the viewing public. You know, there's at this time 155 confirmed positives in the county, Lowndes County. We have 13 inpatients that are either positive or under investigation in an inpatient bed. We have lots of testing going on in the region because the governor is really pushing us to get more people tested, and more people want to be tested. But I think what's most telling is we've had 8 days without another inpatient COVID death. And that's 8 days without another. So we're at 13 deaths, and our heart goes out to those families. But there has not been another in 8 days, and we are watching that very carefully. Another positive trend, the only 4 deaths that I know of at this time recorded in the county, and that has not went up. And here's another one. Today we only have 1 COVID-19 patient in an intensive care unit bed that's on a ventilator at this time. Now that can change. I don't know if we're beyond the peak. Here's my view on things. I think we need to still plan for the worst, hope for the best, and be practical about the matter. Just like you and I having our mask on before we started recording, we should continue to do that. Social distancing has improved the situation. We'll know in the coming weeks if we're going to have another immediate surge or not with all the relaxation of everything. But I would encourage everyone, let's just stay diligent, wear a mask, clean our surfaces, wash our hands frequently, keep our distances, and just be really, really smart about keeping this thing contained.
That sounds great. Mr. Dean, last week we restarted elective necessary surgeries and diagnostic procedures, as well as some physician office visits. And how are we going about keeping people safe as we are doing that?
Another great question, Erica. So what I'd have everybody know first is we didn't stop taking care of every other type of patient during this COVID-19 crisis. We still delivering babies, still mending broken hearts, still patching up broken bones, and still doing necessary surgeries and outpatient testing, and many, many more of those patients than we had COVID patients. What I'm very proud of is the community did what we asked: stay home and not come to the hospital and not try to visit. But now there are those that are out there that have been waiting and putting off what's called an elective or a needed surgery or a procedure, and we're inviting them back in, and we have opened those doors. We meet all the criteria. We have plenty of personal protective equipment, we have plenty of beds, and we have seen a flattening of the statistics like we talked about a minute ago. With that being said, folks can appreciate the fact that we're still protecting ourselves, and we want to protect them from the spread of COVID when coming. And because we have taken that seriously, we've done things to make sure we separate patient types. Remember, we have dedicated COVID units. We have a dedicated entrance for outpatient testing and for outpatient surgery, and not commingling those patients. But here's a fact that maybe everyone doesn't know. Every patient that comes in for surgery is required to have a COVID-19 test and quarantine for the couple of days before they have their surgery. We think that's a very bright thing to do in order to protect the patient and our workforce as we have in the past. But just know, if you need surgery or need emergency room services, all those protective measures are put in place to make sure you have a safe experience and get the care you need. Should not delay needed care because we're afraid of coming to the hospital. We want you to come if you need us and be appropriate about that and not fear it.
Great. There's been a lot of discussion regarding financial impacts of small businesses, large businesses, hospitals right now with the decline in surgeries. Can you explain? I know you've talked openly with our staff and our management teams as well as some of our media. Can you kind of give the viewing public a little bit of insight on what we're doing to manage that?
I can. It's a very challenging time for a lot of people across the nation. In the state of Georgia, in our community, businesses have been shut down. They are reopening. Just like we're reopening for elective surgery, we were shut down for a long time. Everybody knows this is a very large business operation, and it receives funding through the number of patients we take care of. So here are a few interesting points. We are down about 35 to 40% of our total patient revenue. That means patient activity is down because we ask everybody to stay home. Okay. Now the problem is we still have all of the expenses. So our team has been evaluating what it is we should do at this point in time, and just like in the COVID-19 crisis, we've taken measured steps. We're trying to plan ahead. What we don't want to do is have such a financial downturn that we're in a crisis. So we've begun to do a couple of things. First of all, we typically flex our staff up when we're busy. We flex our staff down when we're busy. And that just means folks get more hours or they take some time off. Well, we're doing that very thing. A lot of people have asked, are y'all going to lay off folks? No, there hasn't been a decision to lay off, but I can't tell you that significant measures wouldn't be put in place if, in fact, we didn't have a rebound in our revenue. Anybody that operates a business would appreciate the fact that if you're sustained down in revenue for 35 to 40% and you're built for 100%, you got to make an adjustment. But what we've shared with our employees and the confidence they have in our plan is that we're going to be measured about it. We're going to wait and see, adjust, and react according to the circumstances. And right now, what we're doing is asking everybody to take a little time off, flex down, and then do some other things like reevaluate, re-engineer, reorganize, reoperationalize certain services so we can just get some waste out of the system that may not have needed to been there anyway. And then we're going after the non-labor supplies, other types of services that may not be as essential, and we're asking and looking for reductions there. Here's what I would have everybody know. It's not a crisis. We have a strong organization here. We can weather a bit of a storm, but we have to be prudent and think about the what if. What if it remains? What if it doesn't return? And that's what we're all a little worried about. But I can assure you we'll be talking about it very, very openly if we go to another level of reductions or anything like that. Right now, I'm very proud of our staff. Our leadership team has responded, and we're reacting, and we're lowering those costs accordingly. And we hope with the increase in surgeries, we'll see those revenues start coming back.
That's great. And on that same kind of token, we did recently have a great announcement of bringing on 6 new physicians to our physician network. And I'm sure that's a growth strategy and a very important strategy for providing great care to our community. Can you elaborate and tell us about that decision?
I can. Again, it's sort of a dichotomy, isn't it? I mean, on the one hand, you're trying not to spend money and lower costs, but on the other hand, you're announcing that you're acquiring a practice and you're spending money. Well, again, everybody understands that the way out of this thing and the way to our future is through growth. Growth in services, growth in capability, growth in the number of doctors. There are not enough physicians in this town. And then there are business arrangements that just helps everybody. It helps the community, it helps the organization, and it helps the doctors. The acquisition of the Valdosta Medical Clinic had been planned for many, many months. These fine physicians and their staff have been working really hard. They've been around for a long time. They take care of a lot of this community. And we've been talking for a long time, and it just happened to culminate at this time. But I would tell you, if the opportunity presents again during this adjustment period, we're going to pursue it because together we're stronger. Because we can share things, We can lower the administrative burden for the physicians, and we can improve the value of services for the patients by working together. That's the goal here, and the community will hear a lot more in the coming months about even more physicians coming with us and on board, new to the community, and these new openings. We're very excited. We want to grow our way to success. We don't want to cut our way to financial prosperity. There's no way to do that. You can't cut enough to win. You got to grow, and every business owner understands that.
Yeah, absolutely. Mr. Dean, there's a very special day coming up next week that honors a group of professionals in our organization. Do you want to tell us a little bit about that?
I do. It's our nurses. It's National Nurses Day next Wednesday, May 6th. We're very proud of this group. They come from all walks of life. They're very special because they provide a full range of care throughout this organization, throughout the community, throughout the region, and throughout the state. I want to shout out to nurses. Y'all make hospitals hospitals, and that's why we come here, is because you're here. I ask the viewing public to join me. We'll celebrate. Call a nurse, write a nurse a note, tell them thank you. They do work hard. They put themselves out there for us. They're built for this, but it's always good to hear more appreciation. And the community's been great about telling us how much they appreciate us. But Wednesday, May 6th is their special day, and we're going to be celebrating. I ask you to join me.
Thank you, Mr. Dean, and thank you to everyone for tuning in today. We hope it was valuable for you to hear directly from us. And if you have any questions or if you have any topics for suggestion, please feel free to comment them below, and we will definitely get you the information you need. But thank you again. Please continue to follow us and stay tuned to our website and all the updates that we're putting out. Thank you.
Thanks, everyone.